Hi, my name is Bianca. I'm a full-time nursing student at Nevada State College, and I'm here today with my professor Marcellus. Today at Scorpio Hospital in room 300, I have patient Monique Rogers, who is a 32-year-old female, in for a head-to-toe assessment. About a few weeks ago, the patient started having new acute onset symptoms of a tension headache in the occipital region. The patient's pain level was a 6 out of 10. A little bit of background about the patient. The patient has no known medical history, and the patient has a surgical incision in her abdomen in the left lower quadrant because of an examination she did, but no surgical procedure was performed. The patient has no known allergies. So upon my assessment, I took her vital signs. Her vital signs for temperature was 98.7 degrees Fahrenheit. Her pulse was 80 beats per minute. Her respirations were 16 respirations per minute. BP was 120 over 80, and pulse oximetry was 100 on room air. So the patient appeared to be alert and orientated ×4. Patient appeared to be the stated age of 32 years old and identified as female. The patient's skin appears to be brown, intact, and warm to touch. The patient's skin toger is elastic with no tenting noted. The patient's head is oval shape. Patient's hair is brown with no masses or lumps present upon palpation. Her pupils are equal, round, and reactive to light and accommodation. Patient's ears are symmetrical with no discharge noted. Patient's cranial nerves 1, 5, 7, and 10 are intact, and patient's tonsils are +1. Patient's neck appears to be symmetrical with no masses or lumps present. Patient's swallowing is intact and even. Cranial nerve 11 is intact. Patient's breath sounds are clear and equal bilaterally, and chest expansion is even. Patient has no murmurs present upon auscultating heart sounds. Patient has normal active bowel sounds in all 4 quadrants. No distension or gynnomegaly, masses, or hernias were noted. Patient's sensation is intact in both upper and lower extremities. Range of motion and muscle tone in upper and lower extremities are intact, and muscle strength is 5 out of 5. Patient had no signs of pressure ulcers in high-risk areas. Patient's coordination is intact with finger to nose, heel to shin, rapid alternating hand movements, and tandem walk. Romberg was negative with no swaying noted. The patient had no present pain during the head-to-toe assessment. My recommendation is the patient follow up with her primary care physician and neurologist for further evaluation. Thank you.